to be at high risk of getting this infection. That is, some of these factors, we have the early onset of sexual activity, that is less than 16 years when we indulge in sex. When we are less than 16 years, we are at risk of getting this infection. And then when we have multiple sexual partners, when somebody starts giving birth at a very early age, a very tender age, we have cigarette smoking, and also those clients that have that are immunocompromised, that is, those clients who have HIV infection, and others that have, usually there is a virus that is herpes simplex. If you have a history of continuous or recurrent sexually transmitted infection, and also if you indulge or you have a relation with the partners who are high-risk partners. And when we talk about high-risk partners, we mean these partners who have multiple partners, and also they might be having exposure to other smegma from other different partners. So some of them, maybe we can also have the uncircumcised male. They usually also have that risk of harboring the same virus in their prepuce, among others. So what does the anatomy look like? As we were told that the cervix is usually the lower part of the uterus, this is how it usually looks like, and it has two parts. That is, we have the endocervix and the ectocervix. The endocervix is the one that is the inner part, the reddish part. That is the endocervix. The pinkish white part is the one that is the ectocervix. These two different parts have different layers, whereby the endocervix, it is usually layered with it has a columnar layer and the epithelium, and then the outer, the ectocervix, is the outer part that is usually visualized commonly, it is covered by the squamous epithelium. What usually happens between the two parts, we have different changes that usually occurs at the endocervix and the ectocervix. So the two meet at a point whereby, these are some of the points that we really consider when we are doing screening, where the columnar epithelium and the squamous epithelium meet. This is the point. This is called the squamocolumnar junction. The squamocolumnar junction comes derived from the word the squamous cell and the columnar epithelium. That is where they meet, and usually they change as per the age, depending on the age of a patient, depending on the type of family planning a patient is using, maybe whether the patient is pregnant or whatever the circumstances. Especially, it is all dependent on estrogen levels. So the area of the cervix, usually, that the metaplasia is whereby we talk of the endocervix being overexposed. When it is overexposed, then it means the acidic nature of the vagina usually becomes more. It is a place where the columnar epithelium cannot survive very well. So what happens is the squamous epithelium needs to cover up the columnar epithelium so that it is safer for it. And when the squamous epithelium is trying to cover up the columnar epithelium, then it means what is happening there is something called metaplasia. And usually metaplasia, it means there is change of a normal cell from to another normal cell. But with cervical cancer, it is a change of a normal cell to an abnormal cell. So what happens? That is what we are trying to explain, that the endocervix is usually lined with the columnar epithelium, while the ectocervix is lined with the squamous epithelium, and they usually meet at the SCJ, that is the squamous columnar junction, and it usually varies due to the estrogen levels. But change of the deviation from the normal to abnormal, it is usually called dysplasia, which means when your cells are changing to become cancerous. That is the process where we call dysplasia. And usually this change usually starts from the base, the basal lamina, that is the basal layer of the cervix, and usually extends outwards towards the epithelial lining. Now, what happens? We've talked about a persistent HPV. We've talked about a persistent HPV that needs to stay in the body system for some time. This means it stays in the system about 10 to 15 years after being infected. After getting the HPV virus, you will have to stay with it in the body system for that long so that it starts converting to the precancerous or to start changing into abnormal cells. And usually it progresses very fast in the immunocompromised. That is mostly the HIV positive clients. It is about 6 times in HIV positive clients, unlike the normal clients. So it usually originates from that junction that we've talked about, the squamous-columnar junction. Now, when it comes to screening, that is our point of reference where we need to check where is the squamous-columnar junction. That is the point which will tell us where the transformation zone will be, so that we can be able to know where is the change taking place. So if you look at this cervix, the squamous-columnar junction is this at this point. And if you look at the endocervix, you have the columnar epithelium. If you look at the outer part, we have the squamous epithelium. So the two, where they meet, this is now our point of reference. So what happens? The position is usually influenced by these 4 things that we've talked about: the age, birth, trauma, use of contraceptive, that is the combined oral contraceptive because they have estrogen in them, and then also pregnancy. So what are the effects of estrogen? What does it do to the cervix? That is why we are talking about this estrogen. When somebody has high levels of estrogen, it makes the cervix to swell and enlarge outward. So this makes it to expose more of the columnar epithelium, that is the endocervical epithelium. It everts, like when you are curling your lips, when you look at your lips, the inner part, it is more on the outer side. So that is what usually happens. And then it means the columnar epithelium will be overexposed. But as the woman grows older, the squamous-columnar junction starts retreating inwards. Remember, when we start aging, our estrogen levels start decreasing in amount. So it usually changes, the changes usually respond to the levels of estrogen. As per that, you can visualize from this. This is the overexposed cervix. That is the endocervix. This is the columnar epithelium, the red part. This is just a normal cervix. It's not an infected cervix for the woman of a reproductive age. But in the second figure, this is a woman who is a postmenopausal woman who has already undergone all those changes up to now. She's not having her menses, everything has stopped. The elderly woman. So as you can look at it, the exposure of the columnar epithelium is not the same. It has gone where? It has gone much deeper inside. That is why when it comes to screening, we will have to consider different methods of screening depending on the age of the patient. So this is just but a figure to show you from childhood what happens. This is the squamous epithelium and this is the columnar epithelium. And the original columnar epithelium, it is at this point. So why are we talking about the original squamous-columnar junction? Because this is the initial junction where the squamous cells and the columnar epithelium met when this person was young. And because of the normal changes that happens during developmental stages at different positions, there are those changes that happens. That is metaplasia. When metaplasia starts taking place, when the cells start now changing from one point to another, now the points start moving from one position to another. That is why you will see the original squama-columnar junction in childhood. This is where it is positioned. As you move to the adolescent and post-adolescent woman, it is moving. Reason being, this is the point where now the dysplasia that we've talked about, the abnormal cell change or the normal cell change takes place. And that becomes our point of reference, where we need to screen and where we need to check for the changes. Because if you screen this patient and you find there is something which is outside these points, it means that is not something we are looking for. We need to look for that lesion at the transformation zone. So the transformation zone is this point where the original squama-columnar junction and the new squama-columnar junction is. What are we talking about when we say the new squama-columnar junction? The new squama-columnar junction comes about by when the epithelium, the squamous epithelium is covering up the columnar epithelium and it reaches a certain point. And there are several features that we need to look at to know that this is the transformational zone, that we will look at it. Then when we come to the original squama-columnar junction and in the postmenopausal, you can see from the previous diagram to this diagram, it is true that it is moving inside. These are just not trees, but this is just the cervical canal, and this is the endocervix, the columnar epithelium. The dark part is where now the transformation zone is. And that is why it is sometimes very difficult when you get a woman who is about 50 years. When you are doing a screening, you may not be able to visualize the transformation zone. That is why we encourage such women to run pap smears, because we need to collect the endocervical swabs. So this is just but a change. Then this is a normal cervix which has undergone metaplasia. So as you can look at this, there was an overexposed columnar epithelium, and in the process, this is our cervix, and this is a cervix whose the woman has had some deliveries. That is why it looks like a fish mouth. And this was the columnar epithelium initially. The squama-columnar junction is at this point. Now, what is happening to this? You can see there is the pinkish white that looks like is similar to this other part. This part looks like this because metaplasia is taking place. The squamous epithelium is trying to cover up the most fragile columnar epithelium so that it can be able to survive within the acidic environment of the vagina. That is metaplasia taking place. Now, when we look at this, these are now what we need to look at when we are looking at the transformational zone, because that is the point where we need to check whether we are having an abnormality or not, whether we are having a lesion or not. So what do we need to see to know that we are in a transformational zone? One thing you can see, there are things that look like pus-like pustules or so. These are not pus, but this is a normal cervix. These are called Nabodian cysts. How do they come about? The Nabodian cysts come about because the columnar epithelium is usually a single layer epithelium, and it usually has crypts. It is like in a curved way. Now the crypts, what happens is they collect the mucus, because the columnar epithelium is a mucin-producing epithelium. And in the process of metaplasia, where the squamous epithelium is covering the columnar epithelium, now the crypt openings, what happens is they are covered by the the squamous epithelium. In the process, the inner part, the inner